San Diego 6 News in the morning. Your station for balanced news.
A diabetes discovery. We'll have Dr. Linden here from the Jolla Institute to introduce us to a new treatment that promises to help patients. All right, thanks. Well, our next guest likes that story just because it's talking about a healthier lifestyle, and that helps attack the problem that he's been working on, which is diabetes. Dr. Joel Linden is here again today from the Jolla Institute with, I think, some really exciting news on some possible breakthroughs here in the treatment of diabetes. Now, first, though, let's set the groundwork. How big of a problem is diabetes?
Diabetes is a huge problem. It's been increasing. There's been a tripling in the incidence in diabetes since 1990, and it's reached the point now where there are over 26 million Americans with diabetes. That's almost 10% of the population. And it gets worse because as you age, the incidence goes up. So if you talk about people who are 65 years or older, the incidence is 1 in 4 people. And the consequences are very severe, because if you have diabetes, which means high blood sugar, then your blood vessels are injured. You don't deliver blood to tissues normally, and you can have all kinds of problems: heart attack, stroke, kidney failure, which can kill you. You can go blind, or you can have problems with peripheral blood flow, and you can lose your toes or your feet to amputation.
Oh, so you've got 10% of the population with diabetes, the incidence going up, so getting a handle on this is really important. Now, you say it's high blood sugar. It's the body's inability to deal with that sugar, and the body becomes, in some cases, what, insulin resistant, where insulin is what helps process the sugar and get it into the cells where it needs to be.
That's right.
If it can't do its job, then you just end up with a bunch of sugar in your bloodstream, correct?
Yes, that's right.
Okay.
So there's basically 2 causes of diabetes, and they both involve insulin. So in one case, the organ that makes insulin, the pancreas, a small organ behind your stomach, fails to secrete enough insulin. That's called type 1 diabetes.
Okay.
And that's how you treat that, by taking insulin. The second type, which is the most common, is called type 2. And in type 2 diabetes, you make insulin normally, have normal insulin levels, but your tissues become resistant to insulin. They're said to be insulin resistant.
That sets up the discovery that you've made now, and it's got widespread implications here. You've discovered what it is that is causing the body to become insulin resistant?
Yes. So surprisingly, scientists over the past few years have discovered that type 2 diabetes, the insulin-resistant form, actually is linked to a problem with the immune system. So there are certain immune cells, which are cells that fight off diseases. Certain cells called macrophages. These cells release chemicals that normally would be used to fight off invading bacteria. But in type 2 diabetes associated with obesity, these macrophages get activated. They release certain chemicals, and those chemicals actually are what cause the insulin resistance. So we've been trying to figure out how to inhibit macrophages from releasing these chemicals that cause insulin resistance in type 2 diabetes.
So these chemicals are released for a reason, but this unintended consequence, then, I guess if there's intention in nature, the unintended consequence is it contributes to diabetes.
Yes, well, normally macrophages will be activated when you have an infection. You need them. They're critical. If you don't have macrophages, you'll die of infections. So what happens in diabetes is when you get fat, these macrophages, for some reason, accumulate in the fat. They build up, they become activated inappropriately, and then they lead to insulin resistance.
So now that we have a good idea of what's causing that, how close are we to a treatment?
Well, so now we're beginning to understand what activates the macrophages, cause them to release these chemicals that cause the insulin resistance, and we're trying to develop drugs now that will inhibit that macrophage activation. So we have drugs that are now in clinical trials, phase 1 clinical trials, to inhibit this process, and we're probably 4 or 5 years away from a drug approval, assuming that everything goes well.
So we're getting closer. Now, we've only got a couple of seconds, but I did want to touch on the fact that this has implications for a lot of other diseases and conditions as well, because we're talking about basically inflammation here, right?
Yes, so inflammation is turning out to be involved in all kinds of diseases where we didn't really think it would be involved. Diabetes is one example. Atherosclerosis is another example, where we're finding that the immune system gets activated. So figuring out how to control that inappropriate activation is going to be helpful for many disease processes.
All right, Dr. Jolla Linden from the La Jolla Institute. Anytime you've got a development, come back and let us know. This is exciting news for a lot of folks.
Thanks.
Okay.
Bye-bye.
Thanks for coming in. All right, for more information, you go to san diego6.com, click on Hot Topics.